All right, so today I'm sitting with Dr. Esther Amagoh, the CEO of the Pelvic Place PT located in Houston, Texas. Dr. Amagoh is a force to reckon with, and she is the pelvic floor queen. So I'm really excited to be able to talk to her today about all things pelvic floor and pelvic floor physical therapy and all the amazing work that she does. So welcome, Dr. Esther.
Thank you. Thank you so much for having me. I'm super excited to be here with you.
All right, can you tell us a little bit about yourself and how you got into pelvic floor PT?
So my name is Dr. Esther Amagoh. I have my doctorate in physical therapy and I specialize in women's health and pelvic floor rehab. I have been doing this for the last 9 years. I usually round up to 10, but it's really 9 years, but I use those words interchangeably. So I started a hospital-based practice in Richmond, Virginia. I was recruited by the Women's Hospital of Texas and relocated to Houston almost 4 years ago. And I branched out and started the Pelvic Place Physical Therapy last year. My goal is to empower people with pelvic floor pain. This is pregnant and postpartum patients, patients that have pain with intercourse, and of course, males that also have pelvic floor dysfunction. I just feel like this is such an important and powerful area to work with because most people don't want to talk about it. It brings so much discourse or shame or discomfort to talk about it, but yet it impacts so much of our life. So if I could shed some light in this area and kind of help restore people back to their normal function, that would be the biggest blessing in the world. So that is why I chose this field and this is what I do.
Awesome, awesome. Can you tell us a little bit about what the pelvic floor is and what it really entails when you talk about the pelvic floor?
So pretty much the pelvic floor are the muscles, the pelvic floor muscles are the muscles between your legs. To simplify it, those are the muscles between your legs. Males and females both have pelvic floor muscles. The biggest misconception is people are like, oh, you work with pelvic floor, you only work with women. No, we work with men and women. The pelvic floor are the muscles that support your bladder, your bowel, and your vagina. In men, it's the muscles that support your penis, the muscles that support your bowels, and pretty much hold you together. They're the base of your core. So essentially your abdominal muscles attached to it in the front, your back muscles attached to it in the back, and your pelvic floor is on the bottom. Your diaphragm is parallel, but on the top of it. So essentially it holds everything together. If you were to use an analogy, if you had a house, the pelvic floor would be the foundation of the house. So if your walls being your abs and your back, if your walls are not strong, or if they are strong, but your foundation is weak, you're not going to have a functional core. So your pelvic floor is the base of your core.
Okay. So I have some questions from my listeners and blog subscribers. And the first question is, how does a menstrual cycle influence pelvic floor integrity?
Your menstrual cycle, essentially, as you are going through your cycle, some people have pain or they have discomfort or they have cramps and things along those lines. It doesn't necessarily impact your pelvic floor integrity. Your integrity is still there, but a lot of people, because they have pain or discomfort or cramps, it can cause the pelvic floor muscles to tighten up. So a lot of people end up having pelvic floor dysfunction just because, not dysfunction, but they end up having pelvic floor hypertonicity or increased tension in those muscles simply because they're on their cycle. The pain can also radiate to your lower abdomen. So most people will complain about cramps or discomfort in their lower abdominal region. So again, it's just increased tension.
Gotcha. Can you tell us a little bit about fibroid pain and how that is manifested in the pelvic floor?
Again, because your pelvic floor muscles are literally holding up the pelvic floor organs, if you have fibroids, oftentimes they're increasing in size and they can cause increased tension in the pelvic floor muscles. So it could be a little uncomfortable, it can cause pain, and people can have restrictions based on that. So we do treat that at the Pelvic Place Physical Therapy. We do mobilizations and things to help decrease the restrictions of the fibroids so they don't have as much discomfort, they don't have as much pain, and it decreases the rate in which it is growing.
All right. Now, before we go deeper into the pelvic floor, I know that Dr. Esther, you like to demonstrate the pelvic floor model, and you were generous enough to have it with you. So I wanted to see if you could just kind of go through what the pelvic floor looks like and what is it that you look at when you look at the pelvic floor using the model.
Oh, perfect. So I have my model. It is right here. So essentially, this is your pelvis. So I'm just going to put it in perspective. So this is your pelvis. It's about right here, right? So your abdomen is in the front. Your back is in the back. So if I was standing sideways, this is what you would see. You would see my hips, my abs will be in the front, and my back would be in the back. My pelvis is pretty central. So now if I was to sit down and lean back and separate my legs, this is what you would see. You would see my clitoris, my urethra, my vagina, and my rectum. All of these muscles surrounding this is your pelvic floor muscles. So again, your pelvic floor muscles are supported by your abdominal muscles and also your back, and your pelvic floor holds up the organs internally. If I was to open it up, you would see the muscles internally. This is your bladder, your bowels, your vagina, your uterus, and over to the sides, your ovaries. Your abdomen, if I take this out, your abdominal muscles will attach here. Remember, so orientation, this is your abs. Your abdominal muscles will attach here, and this is your back, this is your tailbone. Your back muscles will attach here. So if you have back pain, it could be referred to the pelvic floor, or it could be referred from the pelvic floor going up towards your back. Same concept of if you have abdominal pain, it could be referred from your pelvic floor, or it could be referred to your pelvic floor.
Awesome. Thank you so much for that visual. I know most of us like to kind of see what things look like in 3D, and so I really appreciate you doing that.
No problem.
So hopping on to the next question, how does sciatic pain affect, how does the pelvic floor, I guess, affect sciatic pain on heavy flow days? And is there a correlation to that?
Is there a correlation between sciatic pain with heavy flow days? That's a good question. So is there a correlation between your heavy flow and sciatica? I can see how they would feed off of each other, but then they shouldn't necessarily be a correlation, because if you have everyone that has a heavy period does not have sciatica symptoms. Does that make sense?
Yes, ma'am.
If they were to have sciatica symptoms, it may be a secondary effect because they have so much tension. Again, you may have increased tension from your lower abdominal muscles through here because of your uterus shedding the lining and causing discomfort as you're having your heavy flow. Now, as a result of that, I can see how people would want to manage their pain by crunching or trying to decrease the space there. And in that action alone, you're flexing your trunk, your gluteal muscles are tightening, and that could put more pressure on the piriformis muscle, which is the muscle that is related to the sciatic nerve. So if that muscle gets pressed too tight, or if it gets restricted, it can cause you to have sciatic nerve pain because it's essentially pinching on that nerve. So now, would you say the menstrual cycle caused the sciatica symptoms? I wouldn't necessarily go that far, but I can see how they would be related.
Excellent. All right. So next question, how does pregnancy influence the pelvic floor?
Okay, that's a good question because I see a lot of pregnant patients. So with pregnancy, essentially and again, this is the pelvic floor model. I'll refer back to this model as often as I can in terms of the questions, just to put things in perspective. But again, if this is your pelvis, I'm gonna open this up. Just for orientation, again, this is the vagina, this is the uterus. So your baby grows in here when you're pregnant. And what happens is your baby expands this area. So oftentimes you're more likely to have low back pain because your uterus is growing backwards, and you're more obviously likely to have abdominal pain or an abdominal, as your uterus grows, you can see it in your abdomen, right? So oftentimes you're likely to have increased pressure in the pelvic floor muscles. You're often likely to have increased complaints of constipation or hemorrhoids. And in the front, you're more likely to have pubic symphysis pain. I recently heard patients actually call it the lightening crotch. Have you heard that term before?
Yes.
And it goes right into your vagina from this area. So again, that's pubic symphysis pain. And of course, as your baby is growing, this area is in itself is widening. So most people are likely to have some round ligament pain. So if I was to show you on myself, year round ligament would be about right here. So sometimes people will have concerns or discomfort in this specific region. The lightening crotch would be pubic symphysis pain, which would be right here. And you're likely to have SI joint pain, which is in this triangular area right here. All of that combined could cause you to have discomfort in the pelvic floor or tension as your pelvic floor muscles struggle to support your growing uterus.
Gotcha. And I know when I started seeing you when I was pregnant with my daughter, it was more for back pain, but then we explored a lot of other things like my pelvis being out of, position. And you really actually did a great job of helping me with exercises that my husband could help me with too, just to kind of like, realign my pelvis. One thing with the crotch pain that I remember really how I slept was so important. And Dr. Esther, you were so good about like actually doing demonstrations for me with a whole bunch of pillows and how how I should sleep. And it was like night and day. I remember before I started seeing you, I would wake up to go to the bathroom, and I guess because my pubic symphysis had kind of been in one position, I would get up and it was the worst pain.
Right.
And the funny thing is I still sleep with all the pillows. And my daughter's going to be 2 next week, and my husband just says, "Oh, are you ready to make your pillow nest?" Because it's a lot of pillows, but I don't even remember how I used to sleep before that. And so that was really, really helpful.
Well, good. I'm glad you found that to be helpful. That actually is the correct way to sleep, whether you're pregnant or not. So essentially, we talked about using a firm king size pillow that supports your thighs, your knees, and your ankles, and that's so important because it gives you adequate space between your pelvis, between your pelvic bones and your pelvic floor muscles. Because otherwise, you're pulling and you're increasing tension in that area. The low back pain that you had was pretty much SI joint pain, and I really like that you touched on that because oftentimes people are pregnant and they complain of these concerns, and it's kind of written off as, oh, you're pregnant. Pregnant people always have low back pain, or pregnant people always have pubic symphysis pain, or oh, it'll go away when you give birth. But in I think about 40% of the population, these discomfort do not go away. So if you don't get it addressed in pregnancy, there's a huge chance that it may still linger. And we've all heard one or two of our mom friends say, you know what, I remember where Junior was, they were kicking me the entire time and I still feel a little bit of discomfort in that area. And that's because those muscles never really return back to normal. Well, whereas if you get it addressed while you are pregnant, you can learn the ways to make yourself more independent and make the muscles function the way they should be, without having that much discomfort. I love teaching my patients ways to be independent, and I love it. I'm glad you're able to relate to it. And it's simple enough that you can carry it on through the rest
Yeah.
of the life.
Yeah, 2.5 years later. And, now that you touched on, when people say, well, I haven't done this since I had a baby. And, one of the things that you really help reiterate is like when moms say, oh yeah, I still leak urine and you're never going to be the same again after having a baby. You're just always going to pee yourself. And after being a student of the pelvic queen, I'm always like, that is not normal. You should not be leaking urine. It doesn't matter if you had your baby yesterday or 10 years ago or 5 years ago. And so I really, really think that there's so much education for women as far as understanding how their pelvic floor works and really, really understanding taking care of themselves, and that those problems are really repairable. And you do such a good job of like emphasizing that for women, especially on your Instagram. I think, you're here to dispel the myth that leaking urine is normal, because it's not.
It's not. It is absolutely not. And I tell my patients, I know that people tell you that, oh, well, moms, they do leak when they run, jog, or whatever the case may be. But no one, absolutely no one should leak in urine. If your muscles are, if you're running or doing whatever activity it is, you shouldn't be leaking urine. It doesn't matter if you're 10 years old, 22 years old, or 75 years old, whether you've had a baby or no babies, you should not be leaking urine. And pelvic floor physical therapy is such an affordable way to handle this, so that way most of my patients are able to go back to their functional activities, be it running marathons or just jumping on a trampoline, without leakage. Within the first visit, they're seeing at least a 50% improvement. And within 4 visits, which is like 4 weeks, they're back to normal. They're definitely back to normal and doing the activities that they enjoy. If you had to compare that with buying a pack of pads every day for the rest of your life, the cost of physical therapy is certainly a much more cost effective and much more adaptable way of living. and it improves the quality of life and without insecurities at that.
All right, and that leads to the first question about leaking. So this person asks, I have a 6 and an 8-year-old. I have been able to overcome most leakage issues from my cystocele using some pelvic floor exercises, but I'm a runner and I still leak almost every single time I run. I have written it off as normal at this point, but is there anything else that I can do to help? I dash to the shower as soon as possible after every run and race because I feel so gross.
No. First of all, thank you so much for submitting that question. I know it takes a lot of confidence and a lot of self-motivation to even write something like that. And thank you, because your story is a lot of women's stories. So thank you so much for being able to write that and speak on it. But yes, there is something you can do. Pelvic floor physical therapy. Pelvic floor physical therapy will help to strengthen those muscles. We'll talk about things that you should be eating and drinking and things that you should avoid, such as caffeine. Caffeine is a bladder irritant. It will irritate the bladder and cause you to have more frequency and more urgency in terms of urinating. And we'll basically give you exercises that can strengthen the muscles. Not only that, you're getting a lot of education. And if you needed extra assistance, we do electrical stimulation to strengthen those muscles that much more. We do ultrasound, we do laser, and things along those lines just to help increase the functional capacity of these muscles so that way you are not leaking. I highly, highly, highly recommend that you see a pelvic physical therapist. And you should be fine. It is something fixable. You mentioned that you have a cystocele, which is a prolapse of the bladder. With physical therapy, there is you can reverse the chance, the severity of a prolapse up to 2 grades. So there are 4 main grades of a prolapse. Of grade 1 is it's slightly falling down, but you can't really see it in the vagina. So here's a visual. So with a cystocele is when the bladder is falling into the vaginal vault. A rectocele is when your rectum is kind of falling into the vaginal vault because of pelvic floor weakness. So a grade 1 cystocele means it's kind of falling down in here, but very subtly, you can't really see it. A grade 2 means it's coming out a little bit closer to the vaginal opening. A grade 3 means it's right at the vaginal opening. I can see it without much effort on your part. And a grade 4 means it's out of the vaginal opening. When you get to a grade 3, surgery is questionable. When you get to a grade 4, surgery is definitely needed. But anything between a grade 1 and a grade 2, a pelvic floor physical therapist would be able to address it. So I don't know if she said she had a grade 1 or a small grade prolapse, but physical therapy can help that. Electrical stimulation would probably be one of the main routes that your pelvic specialist uses. That's what I would end up using if you were to come to me. But it helps to really recruit those muscles fast, re-engages the muscles, and I teach you how to engage your abs and your pelvic floor muscles at the same time so they can work together as a team and hold up the muscles in your organs properly so you can run and jog in peace.
All right. Now, speaking of running, somebody asked, how does running cadence affect the force on your pelvic floor at slower paces? I hear over and over to increase my cadence to decrease the damage, but I run so slow postpartum that a quicker cadence feels so awkward.
So again, your cadence should not necessarily make a huge difference. And I tell people that because your muscles should work whether you're walking slow or walking fast. It shouldn't really make a huge difference. A quicker cadence, if anything, I would think would probably cause your pelvic floor muscles to be a little bit more unstable, which means you will need much more strength and much more force to be able to hold your organs together. But outside of that, it really shouldn't make a huge difference. I don't want you to walk or run faster in attempts to strengthen the pelvic floor. You have to strengthen the pelvic floor in itself. You have to be able to isolate these muscles and regroup and recruit these muscles as needed so that way you can walk or run fast. If walking or running fast is the only way to eliminate urinary incontinence, or if you're doing that in efforts to eliminate or decrease urinary incontinence, that means you have much more of a problem than the cadence. And again, I recommend pelvic floor physical therapy for that.
All right. The next question I have is, can you talk a little bit about diastasis recti and how you can basically, as a pelvic floor physical therapist, diagnose it and treat it?
Okay, so a diastasis recti is a separation between your abdominal muscles. So essentially, um, if these, so essentially my abs are right here, they should line up like this. So with pregnancy, oftentimes if the abdominal muscles are weak, they protrude, right, naturally, but then they start to separate and and you'll see a dome that comes up if you were to like lift your head up or cough or laugh or things along those lines. If you do anything that increases the exertion in the abdominal muscles, oftentimes it's like going from a laying down to a sitting up position. You can see a huge bulb that kind of comes through the middle of your stomach. So that is a diastasis recti. How do I classify it? How do I diagnose this? How do I diagnose it? We test the abdominal muscles. Essentially, a diastasis is a separation of 2 centimeters or larger. So one finger is about 1 centimeter apart. 2 fingers is 2 centimeters apart. So I'll test on your abdomen, so below your belly button, on your belly button, and above your belly button. And if you're lifting your head and shoulder up, and I'm able to put 2 fingers horizontally in that gap, then you have a clinically significant diastasis. Now, here's the thing. Most people have a diastasis. It's literally that vertical line that goes down your abdomen, but it's classified as a diastasis when it's 2 fingers or more. So I try to tell people to picture this. If you were looking at, let's say, Johnny Bravo or The Rock, and they have a 6-pack, that line down the middle is literally a separation. That is normal. It is abnormal when it's 2 fingers or 3 fingers or 4 fingers separated. And our goal is to strengthen those muscles and pull them back together so they support you as appropriately and as adequately as they can. And oftentimes we do have to integrate the pelvic floor muscles, and we work those muscles together so we're able to eventually progress to using your abs, your pelvic floor, your breathing pattern, and your back to stabilize and pull and recruit those muscles back together.
I love the way you use visuals because I feel like it's so relatable, right? When you can say, okay, picture this person versus picture this person,
Right.
and what's normal versus what's not normal. So that's awesome.
Yeah, I try to do that because the pelvic floor is kind of difficult to conceptualize.
Yeah.
So once I am literally showing you my pelvic floor or pointing out things on your pelvic floor, it's kind of hard for people to relate. So I use these visuals. And again, it's part of educating. There's no benefit in having all these tools in your toolbox if you don't know how to use them, right? So I want you to understand what's going on, how it's impactful. And that is why I get the best results. It's not good enough for me to say, do this and do this 20 times if you don't know why or how it impacts you. 9 times out of 10, you're not going to do it. And I think that's why I have such a high success rate within my patients, because I make things relatable. I make you understand what you're doing and why you're doing it. And if I give you those tools, then 10 times out of 10, you're going to do it because you know why and how. And it gives me better results. And my patients are happier as a result of it. So thank you. Thank you very much.
Well, that is actually a good segue into this question. So a lot of people say, yeah, I do Kegels all the time. How do you do an effective Kegel?
Okay, so good question. Oh, I love this. I can go on about this. So Kegels are basically contractions of the vaginal muscles, okay? They're contractions of actually the pelvic floor muscles. If you're doing an effective Kegel, the vaginal muscles should tighten. So essentially, this is one finger. I put my finger inside your vagina, and I have you contract around my finger. If you're doing an effective Kegel, it should squeeze. Your vaginal vault muscles should squeeze around my finger. And in doing that, your rectum, this area right here, should also come up and push on my finger. So essentially should lift my finger up. The visuals, again, I give a lot of visuals. The visuals I give is, hey, I want you to squeeze around my finger, or I want you to stop, I want you to contract as if you're trying to stop yourself from passing gas. So again, that's an internal motion that comes up through here. And again, it pushes on the vaginal muscles and pulls everything up and in. How to not do a Kegel. You don't want to engage your abdominal muscles if you're isolating the vaginal or your pelvic floor area. So oftentimes I see people say, they'll tell me, well, I'm doing Kegels all the time. And I say, show me a Kegel. And they're like, oh, and I'm like, no. So if you're doing an effective Kegel, I should not see anything move. It should be totally invisible. Your abs should not be moving. Your back should not be moving. Your glutes should not be moving. You should not be holding your breath. It's literally just a contraction or a tightening or a recruiting of the muscles between your legs, and simply and solely that. As we get further along, I start to integrate other body parts like your legs and your abs and your glutes and your breathing. But the focus on the pelvic floor muscles, you really have to engage those muscles in itself.
Okay, now speaking of putting fingers in the vagina, this is a question I actually received this week. How do yoni eggs help your pelvic floor? Are they actually worth using?
So I don't recommend them for my patients because essentially, I think it weakens the pelvic floor muscles if you're not using it effectively. Essentially, a yoni egg is an egg or a thing. It's a device. We call it a device. It's a device that goes intravaginally, and you're supposed to keep it inside the vagina and pull those muscles up and have them hold it. Here's the problem with it is that if you're putting a yoni egg intravaginally, and your goal is to hold it in there, well, you may fatigue the muscles because your muscles may not be intended to be holding a contraction for that long. Imagine if I was to hold a 10-pound weight. That's not too hard. I can hold it. But if I was to hold that 10-pound weight for, let's say, 15 to 20 minutes, my biceps would get fatigued. So you're not intending to hold those muscles for that long. And everyone does not need to be doing Kegels. Some people may need to do the exact opposite, which is down training, which means you're lengthening and you're stretching and you're relaxing the pelvic floor. So Kegels are not good for everyone. And if you are going to get a yoni egg, you really want to talk to your gynecologist or your pelvic floor physical therapist to see if it will be beneficial for you. Otherwise, it may be more damaging than it's supposed to, because again, you don't know if you fall into the category of people that need to lengthen and relax the muscles. So if you're going around contracting and holding a prolonged contraction, you may be doing more harm than what it's worth. So I don't recommend it to my patients for that reason.
Awesome. All right. Now, how do you know when the joints go back to normal or when relaxin hormones leaves the body after being pregnant? This person says, my hips are still too loose, and that can also be related to the pelvic floor as well. I'm 7 months postpartum.
Okay. Yeah. So it depends on so essentially the relaxin, let's give our people a little bit of education. The relaxin hormone is a hormone that's present when you're pregnant. This hormone helps to loosen the joints and the ligaments, so that way your body can extend or expand as it needs to provide adequate growth space for your baby. Now, when you give birth, your relaxin hormone naturally drops to a certain level, but it doesn't go all the way. It doesn't get completely out of your system. So essentially, for the length of time that you are breastfeeding, you still have some relaxin hormone in your system. This hormone is completely depleted by 6 to 8 weeks after you stop breastfeeding. So let's say you breastfeed for 2 years. Now, of course, you won't have the same amount of relaxin that you had when you were pregnant, but it will not be what I per se have right now. So if you're breastfeeding for 2 years, you're going to have relaxin hormone in your system for 2 years and 6 to 8 weeks. Okay. So so essentially it's in your body for this pregnancy and postpartum period until you stop until you stop breastfeeding or pumping or whatever the case may be in your specific situation. In terms of your hips still being loose, you probably have an SI joint dysfunction. So we mentioned that already, that if you have it while you're pregnant, 9 times out of 10, or actually 40% of the time, you're still going to have it after you give birth. So you probably just want to make sure that your pelvis is aligned. At the Pelvic Place Physical Therapy, that's one of the first things we check in the beginning of your sessions, because if your pelvis is out of alignment, your pelvic floor muscles are going to be tightened, or they're going to be struggling for stability. So if we are able to adjust or correct the sacrum and the iliac joints alignment, then you're going to have less discomfort and much more stability, and you won't have that hip pain when you're walking or when you're getting in and out of bed.
All right. So this person says, I'd be interested to see if pelvic floor therapy, physical therapy would be beneficial for me, even though I have had surgeries. Sometimes after tons of double unders at CrossFit, I feel like it could be a problem again. I think you kind of addressed that in a previous question too, but I'll let you
Okay.
give a professional view.
Okay. So yes, even after surgery, you may still benefit from pelvic floor physical therapy, because if your pelvic floor muscles if you've had surgery and you still never learned the body mechanics or the ergonomics that you need to prevent yourself from having these episodes, then you may still have the same problem. Oftentimes people think surgery is the end all fix all, but it's really not, because if you're doing a lot of heavy lifting or double unders before and you ended up needing surgery and you go back doing the same exact thing, well, you're still going to have the same issue because you're provoking the same symptoms that you had before. So unless you're learning things to do and things not to do, or learning ways to incorporate these new pelvic physical therapy exercises into your current regimen, you may still have the leakage issues. And oftentimes I do have patients that come in and they say, well, I've had a sling procedure because I used to leak, and now it's only been a year later and I'm back to leaking again. And the issue is we never really learned what to do and what not to do. So again, avoiding caffeine will help. If your pelvic floor muscles are tight, we probably need to do pelvic floor down training exercises to help loosen those muscles, so that way you're able to better contract and relax. And I know that may sound a little funny, because one person may say, well, if my pelvic floor muscles are tight, should I be leaking? Well, yeah, you could still certainly leak if your pelvic floor muscles are tight, because if I was to use another analogy, if this is my bicep or my pelvic floor, I can have a shortened pelvic floor and contract, and this looks good, it looks strong, it looks functional. But if I lengthen these muscles, now my contractions get a lot stronger, opposed to if I have a shortened tight muscle and I'm just contracting. So in certain cases, lengthening the muscles will actually give you the strength that you need. Or you may be weaker and then we need to strengthen the muscles just to start off with. So again, you just never know if you need to be doing strengthening exercises, be it kegels, or lengthening exercises, being down training, to give you the desired end result. So I still recommend pelvic physical therapy for her. It's very much so possible to still leak after surgery, and pelvic physical therapy can help you with that.
Okay. And now another mom did ask about whether, would you still do pelvic floor PT if you've never done it and you have 4 kids? And honestly, my answer would be yes, but is that your view too?
Oh, absolutely. Yes, 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 absolutely. Whether you've had 1 kid or 44 kids, pelvic floor physical therapy would be beneficial, especially the fact that you've had multiple children. That means your pelvic floor muscles have gone through that. I actually call it traumatic stage. Whether you consider your pregnancy being traumatic or not, you're literally pushing out a melon or watermelon, if you want to picture it that way, out of a hole the size of a cucumber at best. So giving birth is literally the only, I call it, surgery that you would go through, and then they just give you more weight or more responsibilities like 24 to 48 hours later. You just gave birth, you just literally pushed a human being out of your body, and 24 hours later you're like, oh, you're back to normal, here's your baby, keep it alive, please remember to cook and eat and feed the baby and vacuum and make sure your husband's well taken care of, or your wife, whatever the case may be, and make sure that your household is together. And please don't forget your 2 little kids that are already running around the house already. It's so absurd to me that we don't really get this much education. And then when we go back for our 6-week follow-up, it's like, hey, are you alive? Is the baby alive? Do you have an infection? Do you have any questions? Okay, bye. It's really not enough information about your pelvic floor. Are you contracting well? Are you relaxing well? Are you leaking? Do you have pain? Does your back feel normal? Does your pubic symphysis feel normal? And it just doesn't have enough information about the mom as a whole. And this is why a lot of OBGYNs refer to pelvic physical therapists, because they're making sure that you are functional and alive, and I'm making sure that your muscles are working as adequately and as appropriately as it could be, just to make sure that you are getting the best and the most optimal use of the body that you have. We're really a really good team. But yeah, I definitely think she would benefit from pelvic physical therapy after 4 kids. I think she would certainly need it, because we just need to make sure that your vaginal muscles are working the way they should, make sure your bladder is working the way it should, make sure your bowels are moving the way it should, and certainly check your abdomen to make sure that your core muscles are functioning and supporting you as best fit.
All right. There's a question here about whether pelvic floor therapy can help with sphincter dysfunction, or are they two separate issues with separate treatments?
No, pelvic floor physical therapy can certainly help with that. So again, pelvic floor physical therapy helps with any and everything in this area. So whether it's a sphincter dysfunction around your urethra where you cannot control and contract the bladder as well as you need to, or a sphincter dysfunction around your rectum where you cannot control and contract your rectum as well as you need to, pelvic floor physical therapy can help with both. So if it's a bladder issue, again, we'll work on strengthening the bladder so that way you're able to control your bladder. I tell my patients, you control your bladder does not control you. And in so many cases, our bladder controls us. Like people walk into rooms and they're already scanning the room trying to figure out where the bathroom is before they sit down. That's a sign that your bladder is controlling you. Or if you have to use the bathroom every time before you leave the house, which I call a just in case pee, where we're peeing just in case there's no bathroom, or just in case this or just in case that. In those situations, your bladder is controlling you. You need to gain control. And by doing that, by coming to pelvic physical therapy, we can learn how to do that together. Same concept with your bowels. You should be able to contract and prevent gas from coming out when you don't want it to come out, and you should be able to suppress your urge to have a bowel movement if you need to. So things along those lines, pelvic physical therapy can help with. And the exact opposite, if you feel like, hey, I always have to have a bowel movement, or I don't have enough bowel movements, what's going on? Pelvic physical therapy can optimize the function of the sphincters around those areas.
Gotcha. And how much does being overweight contribute to bladder leakage?
Well, being overweight is not a good thing for multiple health reasons. But again, if we're speaking specifically about the pelvic floor, I generally tell my patients your pelvic floor muscles are literally holding up at least 50% of your body weight. So remember, your abs and your core and everything's in this area, intestines, all of everything from here up is resting on your pelvic floor. So let's say if I weighed 100 pounds, so to speak, well, that's about 50 pounds of weight on my pelvic floor, versus if I weighed 600 pounds, that's 300 pounds of weight on my pelvic floor. So we can see the disparity between those two. So if you are overweight, then of course your pelvic floor muscles have to be that much stronger and that much more supportive and that much more controlled and coordinated to be able to function effectively without leakage.
Thank you for that. That makes a lot of sense because it's the same concept as the pregnancy, right? You
Yeah.
now suddenly have the crowding of your abdominal contents, and then you have the weight of the baby pushing up down against everything. All
Exactly.
right. Can you talk to us a little bit about painful intercourse?
Okay, painful intercourse. So I treat that a lot. The terms are dyspareunia, which means pain with sex in general. So you have pain with anything going in this area. Most of my patients with dyspareunia, they can still have sex. They just have a little bit of discomfort. There are multiple terms actually. So dyspareunia just means pain with intercourse. Then you have vestibulodynia, which is inflammation around this area, the vestibule, which means you have just pain or discomfort in this area. Some people will call it vestibulitis, or vestibulodynia is a more common word. And that just means you have discomfort in the area. So that also leads to pain with intercourse, because if the penis has to go through this area to go internally, if this area externally is uncomfortable, well, guess what? You're going to have pain with sex, and you're not necessarily going to want to do it. Vaginismus is the third term, is the most severe term of pain with intercourse. And vaginismus just means this entire area is tight, it's closed off. Most of my patients with vulvodynia, they cannot even, not most, actually all of my patients with vulvodynia, they cannot tolerate a tampon going in. They have never had a pap smear or a vaginal exam. They're certainly still virgins, even at age 40. And I have seen that. And that's just because that area is so uncomfortable and has become such an area that brings a lot of anxiety. So these people don't want to even have anything in or around that area. So yes, it could be quite traumatic, and you can see how it can definitely negatively affect your intimacy and your relationships in that way. So pelvic physical therapy specialists like myself can really help to rectify that by lengthening and relaxing that area and talking through what's going on. I'm big on independence, so I have all of my patients with this type of discomfort to get vaginal dilators. I highly recommend vaginal dilators. I sell it in the office. I have multiples for display, so you can just see what it is and they can pick whichever one they want. But essentially, a dilator starts off really small, oftentimes like the size of my pinky, if not smaller, and they go up to the size of maybe a cucumber. And essentially, I'm showing my patients how to use it. And not only do I show them how to use it, but they're demonstrating independence back to me. So I show them and I give them the dilator and I say, okay, well, repeat to me what you just saw, what you just learned. And they're able to go intravaginally. And just that in itself is enough to kind of like break down some of the barriers of fear and anxiety that they have associated with it. And for your less severe patients, the larger the dilator, the much more independent they feel, and they're able to return back to pain-free intercourse readily. Within a few visits, and few visits meaning short, like within 2 visits of using the dilator, my patients with dyspareunia are starting to get greater results. Now, my patients with the more severe vulvodynia, which is just the tightness and discomfort within that entire area, within like a few visits, they're starting to get much more comfortable, and we can usually go up a size on the dilator usually every week. And they're about 6 to 8 dilators, so it takes about 6 to 8 weeks to get the desired end result. But
well, and the thing about, you know, the work that you do, Dr. Esther, it's also very patient dependent and patient motivation dependent, right? I think that, you know, the society has us wanting to fix things without doing the work, right? And so I feel like one thing that you do to empower women is say, these are the very simple exercises that I want you to do, but you have to commit to do them. And the work really speaks for itself. And one thing about your work is that you don't like complicated stuff. You give very simple instructions, and you don't give, you know, I still actually have on my Evernotes, like I saved all the exercises you gave me and I'll glance at them sometimes, but they're very simple. And so you don't have to overthink it, but you do have to do the work.
You do have to do the work. And again, like you said, I give simple exercises. You don't need to do 55 jump ropes, tap on your head and rub on your belly at the same time to get results. You can do things that are very simple, very independent, and quite invisible, to be completely honest, to be able to get good end results. I do that because I myself, I don't like complex things. So if I don't like it and I'm not necessarily the one with the discomfort, then certainly I can tell that my patients don't like it. So the more simple and the simpler.
More simpler.
And that's another thing. You have to learn to laugh at yourself.
Yeah.
I want you to feel comfortable. I don't want you to feel like this is an uptight space. And we talk and we do laugh in our sessions. And oftentimes that actually helps to humanize the situation a little bit. So it's not so hot, it's not so stuffy, it's not such an uncomfortable topic. But again, like I was saying, I give simple exercises just so we are able to integrate it and it feels okay to actually do it, opposed to being something that provokes anxiety and stress and strain. And that in itself causes you to be more hypertensive and causes you to not even want to do the exercises. I believe that's why a lot of people don't do their exercises. It just seems so complicated and so complex that they feel defeated before they even start. And I do my best to make sure that if I give you exercises, I want to make sure that it's something you can do and you're going to be effective and comfortable and confident in doing it. And with that being said, you're likely to follow through with the plan of care.
Absolutely. So somebody asked, do the devices that I've seen advertised online for home use work? So I guess they're talking, I forget the name of this one device, and I think I had asked you about it. I can't think of it now. It was actually a breast pump company that made it, and I had asked you about it. But yeah, what do you think about those home use devices?
So again, and I think I know what you're talking about, is one that goes intravaginally.
Yeah.
Contractions. So again, they could be helpful, but if you're not using it with direct supervision or with some kind of supervision, then you don't necessarily know if you're doing your best work with it. So I do something similar with that. So we do EMG biofeedback, which stands for electromyography. and it goes perianally, so pretty much on your pelvic floor. And the difference is you're able to see yourself contracting, and you're able to see it on a screen, so that way you can say, well, these last few contractions were stronger or better than the first few. Whereas if it's an intravaginal device, that's just basically gauging your muscle activation, you don't necessarily know if it's gauging or picking up your vaginal contractions, or if it's gauging or picking up your abdominal strains, so to speak, or if it's gauging or picking up your gluteal contractions, because it cannot differentiate. It just notices that, hey, you're increasing pressure down there. So you could be doing the same thing diligently wrong, essentially. So
Yeah.
I do recommend getting supervision, and just to make sure that you're on the right path. And again, every patient would not benefit from kegels. None of these devices actually work on down training. So it's important to make sure that you're not kegling yourself into a spastic situation.
Gotcha. All right. And what are your thoughts about new treatments like thermabia?
Okay, so that's like a laser treatment. I think those are helpful. They're usually out of pocket. Usually a session can range somewhere around the $1,000 per session range. I actually looked into getting a Mona Lisa device, so I will actually be purchasing one of those in the near future. So essentially what those devices do is they go intravaginally and externally, and it helps to strengthen the muscles internally, helps to increase circulation, it helps to decrease pain, and helps to alleviate bladder issues. And oftentimes it can help to tighten the labia itself, because after giving birth, sometimes a lot of women will feel like the area just looks a little bit longer, or it looks a little bit fuller, or it may just feel a little bit more uncomfortable. So those devices really help in aesthetics and in the functionality of it. Again, the difference is it's not usually covered by insurance. It is an out-of-pocket expense. The benefits usually last for about a month to start off with. So most people would need 3 sessions. It's actually recommended that if you don't do 3 sessions, you're not going to get as much benefits as you can. But you'll need about 3 sessions a month apart. So the first session will be $1,000. The second session will be $1,000. The third session, again, will be $1,000. And you should be able to keep those benefits for up to 6 months to a year. And then you'll come back each year to get a touch-up. So it's about a $3,000 investment, and takes about 3 months worth of time. Now, if you're able to, if you want to go that route, then you can. But if you could not afford that route, or you necessarily didn't want to go that route, then pelvic physical therapy is covered by insurance. And if for those people it's covered by insurance, and it does also include ultrasound. It does also include laser. It does also include electrical stimulation from my office. I can't really speak for everyone else's office, but you're able to get the same benefits, but you'll have to commit a little bit more motivation and self-drive to be able to reach that. And again, I give enough education and verbal cues and feedback to make sure that you're able to do that. The benefit of pelvic physical therapy over the laser is that you're learning lifestyle changes, and that's really the key. So essentially, imagine being 500 pounds overweight, and you get to a place where you weigh 150 pounds. You won't just throw away everything you've learned, because by then you've learned lifestyle changes, and you're going to keep up the same pattern and be able to maintain that 150 weight goal. Maybe gain a pound or 2, but still you'll still be in that right range. That's the benefit of physical therapy. You're going to regain the pelvic floor muscle strength and control. You may need a touch-up or 2, but still you'll have the base that you need. Whereas with the laser or the thermeva, in your specific question, you're getting the benefits, but you're not necessarily learning everything that you need to learn. In my office, when I do get the device, I'm still going to give you the education that you need, because again, what good is a tool if you don't know how it benefits you?
Absolutely. Now, this question actually is a conversation I was having with somebody this week, and they go, yeah, well, I don't have any issues after my baby, and I had a C-section, and, but I don't feel my scar. And I was like, that's not normal. And they're like, oh, I don't care. And I'm like, well, it's not normal not to feel certain parts of your body. Can you talk a little bit about what you do for C-section moms?
Okay, for C-section, yeah, well, first of all, it is not normal to not be able to feel any part of your body. You should be able to feel everything, and it should feel like your normal body. It shouldn't feel like an out-of-body experience. So I highly, highly, highly recommend that you do touch your scar, ladies. And this even goes for people that have had tummy tucks, or even like a breast augmentation. You really want to work in those areas and break down the scar tissue. So first of all, I teach scar mobilization, which basically massaging and lengthening that scar tissue. So essentially, if this is a scar, we're working on breaking down the scar tissue by going in circles or going in counterclockwise circles, going up the skin and bringing it back down. Your tissue should move. It should glide. It should move. If it's restricted, then the scar tissue from that area can really, scar tissues are like the roots to a tree. All you see is the tree, but the scar tissue can go deep into the muscle, and sometimes be restrictive on the visceral organs in that area. So basically, moving and breaking apart the restrictions from underneath can be highly, highly, highly beneficial, if not from an aesthetic point, but certainly from a functionality point, so you don't feel restricted, numb for years. I hear that all the time. My C-section moms are like, "Oh, it hasn't felt the same in 10 years." I'm like, "What? How is this normal to you?" You really want to kind of help break down that area, and it does bring you back your normal sensory feedback. So again, we do ultrasound in that area, we do laser in that area. I do a lot of massaging in that area just to break up the restriction and help to regain the structure and the function of the area, and teach you again how to do it. These are really fairly simple exercises. It should take no more than 5 minutes to do it, but the results are lifelong.
Okay. And so for pelvic floor PT, do you need a referral from your OB?
Generally, I tell my patients that they should. Some insurance, because it is covered by insurance, some insurance companies would require you to have a referral. But in my office, we can get the referral for you. It's nothing for us to really just make a quick phone call and tell your doctor, "Hey, Miss Jane Doe would like to come for pelvic physical therapy for bladder incontinence. Can we give her a referral?" And they'll just simply fax it over. It's really as simple as a request. So yeah, generally they would need a referral. Some people, if they're just paying out of pocket and they just don't necessarily have insurance, you have that option as well. We take insurance, we take HSA, we take FSA, which are like health savings plans. We obviously take cash and credit and everything in between. So we'll work it out with the patients and try to figure out the best way for you. But generally speaking, a referral from your doctor that you can request on your own, or we can request it for you, we'll get the job started.
All right. And this person asked, what's a normal cost out of pocket? And I'm assuming they're asking with insurance, but I guess you could address both.
Okay, well, out of pocket, the range can be anywhere from $150 to $250, depending on what you're getting done. Some places may even be higher, or generally it's not cheaper than that, but some places may be higher. Depending on what you're getting done, it could range in that area. Some people may even, I think that the highest I've seen is about $350 out of pocket. So that's the out of pocket expense for just a self-pay patient. Now, if you had insurance, it's based on what your insurance says. So it could be as low as your $10 copay, or your $0 copay, or your $40 co-insurance, or whatever the case may be. So it's relatively affordable. We do take most insurances, if not all. And for the ones that do not have insurance, I think the prices are quite affordable, and you get so much in the sessions that, like I said, you're getting your results a lot faster than you would if you were to go somewhere else or to a less experienced person.
Okay. Now, while this conversation has mainly been for moms and women in general, can you tell us more about services that you offer male patients?
Okay, so for my male patients, again, males, they also have bladder issues. So post-prostatectomy, urinary incontinence is one of the biggest things that we treat. So we're treating urinary incontinence in males, we're treating pelvic floor pain in males, we're treating testicular pain, or inguinal hernia type discomforts. And also they have rectal issues. So if they have IBS or constipation, proctalgia fugi, that's a medical terminology, which just means you have really tight rectal muscles, where some people have described it as they feel like they're sitting on a golf ball. I've seen that in males and females actually, and it's very uncomfortable for these people. And oftentimes they feel like there's nothing really that can be done for it. A lot of my patients present with prostatitis type symptoms where they're getting all sorts of antibiotics like Cipro and they're not getting the desired end result. And it's because they don't truly have an infection. The muscles in that area is just so tight that it's pressing up on the bladder and on the prostate and causing prostatitis symptoms, which is inflammation of the prostate, or bladder issues, when in actuality, they just really need to work on down training or lengthening and relaxing those muscles. I don't know if I mentioned erectile dysfunction yet, but that's one of the bigger things that we see in our male population. So pretty much any and everything that fits into your underwear, we fix it in males and females.
All right, so before I get to my final question, this person is not based in Houston, and they asked this question, how can I find a reputable pelvic floor PT? And is there like a database or like a place where they can go to search for somebody in their area?
Yeah, well, there is a site. It's called the APTA Women's Health Section. You will be able to find pelvic floor physical therapists on there. Now, I will tell you that is a paid membership. So every pelvic physical therapy specialist is not going to be on there, but the ones that are on there should be pelvic floor specialists. And you can also call and ask them like, hey, do you do intravaginal exam? Because like I said, it is a paid membership. So if they pay their membership dues, then you'll just kind of have to take their word at it. So you really want to ask them, opposed to just assuming that they are literally the best that's out there. So you'll just have to call and ask and say, hey, do you treat prolapse? Do you treat urinary incontinence? Do you treat vaginal pain? Do you treat rectal issues? Do you treat diastasis recti? What type of treatments do you give? Is it all external? Is it internal? I will tell you, to get pelvic floor internal benefits, you have to be able to look at the vagina. You have to be able to touch the vagina. You have to be able to go internally into the vagina. Imagine going to a physical therapist for your shoulder and they never look at your shoulder, or they never actually touch your shoulder. You're not going to get the best out of your treatment. So again, a lot of people may say that they do pelvic floor exercises, but they're not actually looking at the actual pelvic floor. They're not actually touching the actual pelvic floor. They're not doing physical treatments in and around that area. So you're not going to get the best benefits. One of the biggest things that patients tell me when they come is that, oh, I've been doing pelvic floor exercises. And I'm like, okay, great. Tell me what you've been doing. And they show me things like, I don't know, bridges and leg lifts and things along those lines. And I'm like, okay, while these do carry over into the pelvic floor, they're not specific pelvic floor exercises. So you want to make sure that who you're going to is giving you specific pelvic floor exercises. If I was to give you an example, it would probably be like, let's say you're trying to work on your biceps again, and someone has you doing, I don't know, a marathon, a 10K. Well, although that is great, it's great exercise, it's good for your aerobics, it's good for strengthening and leaning out your muscles and your muscles overall, it's not going to be specific to your biceps. You get it? So I will not tell you don't run a 10K, because it's good to be healthy, but that's not specific enough to get the results you're looking for in your biceps. So doing all sorts of exercises like yoga, Pilates, CrossFit, whatever the case may be, they're good exercises, they're great, but they're not specific enough for the pelvic floor. So I just urge you to ask whoever's treating you, what do you do specifically in the pelvic floor? And of course, they'll do extra add-ons like work on your abs, your back, maybe even your biceps. but it really should be specific to your pelvic floor.
And I like the fact that you address the internal, right? Because one, it's a very intimate relationship, and you should feel comfortable with the individual that you're seeing. But like you said, you want somebody that's actually comfortable with the internal, because like you wouldn't go to an OBGYN that like did an external exam and walked away, right? So if you want somebody that's going to treat your pelvic floor and they don't want to, do intravaginal exams, well, then you're not really going to get much out of it. And on the same thing goes to the patient. If you don't feel like you've established a rapport with the person, then keep looking, because you have to find somebody that you're comfortable to have that relationship with. And Dr. Esther, you do such a good job of keeping patients at ease. I speak for myself, and I know most of your patients too, if not all of them, that really developing that relationship, it's two-way, but you do a good job of easing it, because especially for pregnant moms, you're already going through so many changes. Your body has changed. You feel like your body's letting you down, and you go to somebody and you just want to feel safe and welcome. And you do a really, really great job. So thank you. So last but not least, how can people find you? And I'm definitely going to attach the links to your website and your Instagram and other social media, but how can people find you and how can they get an appointment with you?
Okay, so they can find us on our website, www.thepelvicplacept.com. Simple enough. The Pelvic Place Physical Therapy is what we are, so thepelvicplacept.com. Also, we are on social media. We are on Instagram, The Pelvic Place PT. We are on Facebook. I'm not as interactive on Facebook, but we are there. It's called The Pelvic Place PT. And you can just give us a call. You can Google us also. Our phone number is 713-344-0838. You can give us a call and email us, whatever the case may be. But we are here to help you. We do telemedicine consults. So even if you're not in the Houston area, we can help you wherever you are. I actually did a telemedicine consult last week for a patient in New Zealand. Can you imagine? In New Zealand, they found us online, and I was able to talk them through their exercises on a Zoom conference call like we are on right now. I had another patient from Saudi Arabia. It's actually a male with urinary incontinence issues, just basically asking what can they do. And I can pretty much talk you through most things, but again, I always urge my patients to find a pelvic floor physical therapist in your area. But for the generals, I can talk you through what you should be doing, what you should not be doing, and kind of give you visual pointers with the model, or whether it's with me actually physically demonstrating it to you and having you demonstrate it back. We're able to get some results that way. Any result is better than no result. So a little bit of an improvement would be better than no improvement. At least we can teach you ways to not provoke the same things and try to break some cycles, if not all.
And I just want to reiterate, Dr. Esther stays booked and busy. So if you need an appointment, get to it now because she's super booked, but she's awesome. So to wrap this up, Dr. Esther, I'm going to ask you my fast five.
Okay.
And so it's sentences that you just need to complete. So are you ready?
I am ready.
All right. I'm changing women's lives by?
Empowering and educating them.
All right. One word to describe my journey.
Blessed and highly favored.
Awesome. Self-care is?
Putting myself first, prioritizing me.
All right. My role model is?
Can I be self-grandizing for a little bit?
Be whatever you want to be.
Well, I hate to be self-grandizing, but I really do think my role model is myself. I try to be a better version of myself every single day. I know what I need to do. I know what's on my list, and I accomplish what I can today, and tomorrow I just strive to be a little bit better.
And you're your only competition.
I am really my only competition. That's really, truly what it is. I think that comparing yourself to another person kind of leaves room for self-doubt, and comparison is never a good thing. So I am my own role model, and I encourage people to be their own role model. Stop looking at someone else and look at yourself and see what can I do to be better.
Awesome. All right, last question. My big scary goal is?
To have the Pelvic Place Physical Therapy worldwide.
Awesome.
I know, right? They say if it doesn't scare you, it shouldn't be a goal. So yeah. Right now we're expanding, and that's a good thing. That was on my goal list, and we're already expanding to a new office next month in August, just to kind of create more space to kind of help people know more about the pelvic floor and the Pelvic Place Physical Therapy, and regain their strength and coordination and education just in general about this area. So it's not just an area that we just whisper about and not talk about, you know? I know, don't tell anyone, but I pee a little bit, or don't tell anyone, but I came with sex. And it's like, no, let's talk about it. Let's fix it. Let's get back to
Let's normalize these conversations. And, you know, my goal is to normalize conversations around motherhood, pregnancy, childbirth. And I think there's so much space for all of us in this, you know, space. And one thing that I'm really excited about is women who really are blazing the trail. And, you know, Dr. Esther, I met you when you were employed by somebody else, and you actually, you know, you opened me up about your scary goal back then, which was 2018. Your big scary goal was to leave and open your own business. And here you are 2 years later, thriving. So I'm so proud of you. And I'm just so grateful for your time and for making it possible for us to have this interview and really, really teaching women Like I said, you made me a pelvic floor advocate, and I literally, like, I'm listening in, I'm on mom groups, like I see a post about like leaking, I'm like, that is not normal. DM me, so, and while this conversation does not constitute medical advice, I think that people need to be empowered to learn more about their bodies and to seek help from providers who are holistic and who really want to make a difference. So thank you, thank you, thank you, Dr. Esther. I really appreciate your time.
Oh, thank you. And thank you so much for creating this platform to educate and empower women. You literally are setting the trail, blazing the trail, and just opening more doors for people to talk about things like this. So thank you. Thank you for your time. And thank you. I'm so honored that you thought me valuable enough to put on your show. So thank
Of course,
you.
of course.